Welcome back on the AM show. We've been talking about the Marburg virus. We all ought to be cautious about that and stay safe because this is a nasty business, this virus. It's like Ebola cube. But from there, let's rein in and talk about some politics-related matters, political matters of national scope. We're going to be looking at the latest Afrobarometer report, which suggests that 87% of respondents feel the country is headed in the wrong direction. 85% feel the handling of the economy is piss poor. And there's a lot more. These are record figures we're seeing in quite a while. 72% say their conditions, personal conditions of living are fairly bad or very bad. This is comparatively to just 3 years ago, 2019. We'll also be looking at the communications minister, ASOMDWEE, and her failure to appear in Parliament time and again, among other matters. Our guest this morning, Rockson-Nelson Dafeamekpor. He is Member of Parliament for South Dayi constituency. He also is a member of the NDC and a member of the Constitutional Legal Affairs and Parliamentary Affairs Committee of Parliament. He also is with the Public Accounts, or is it Public Affairs Committee? Right. And standing orders of Parliament. Roxon, thank you very much for joining the conversation.
It's my pleasure to be here. Let me use the opportunity to say good morning to my constituents in Peki, Bali, Preventongo. Dega, good morning.
Okay, so that was a rather succinct one. Let me just issue this disclaimer. We reached out to the other side. We have two major sides as far as our politics is concerned. I'm not demeaning the other political parties, but we reached out to the New Patriotic Party. We did not get a representative. Let me make that clear so it doesn't appear we are on any tangents. We reached out and this is what we had. But we'll also try to get some governance people to respond to some of the areas that we're going to be looking at. But let's start the conversation very quickly on... I'll start with other matters before we get into the Afrobarometer report and also look at Communications Minister ASOMDWEE Ekufo. Let's start with the ASOMDWEE Park. You follow the developments there.
Yes,
Kwaku Anyidoho, your former Deputy General Secretary, was referred to yesterday by Samuel Atta Mills as a buffoon. And he responded by saying that, Samuel Atta Mills should produce the autopsy report of his late brother, our former president, among other things, also saying that he will not set foot, he will not allow the former president, John Dramani Mahama, and even Samuel Atta Mills to set foot at the ASOMDWEE Park. But I'm asking myself, why should this even be an issue? For those of you who know the background, so ASOMDWEE Park, former president laid to rest there. The accusation that former president John Dramani Mahama did nothing about the park and that current president Nana Addo Dankwa Akufo-Addo came and set it up and everything is kosher now. But the Atta Mills Institute, there's a bit of a dispute there because Kwaku Anyidoho had his in place. The NDC circumvented that, created their own. So now there's an official, center for Atta Mills, and that is not the one, funded or supported by Kwaku Anyidoho, who has been expelled from the NDC in the first place. And the family subscribes to the one from the NDC. So that's a bit of a background to it. But how did we get here?
Now, thank you very much. I'm extremely happy that you brought this matter up. Look, it is never correct that President Mahama did nothing about the ASOMDWEE Park. Indeed, who created the ASOMDWEE Park?
Right.
He did. He buried President Mills there with the intention that that could become the
Kwaku says he left it to become...
No, hold on.
Basically a dump.
No, hold on. That is what I want to debunk. He created the park and buried President Mills there. And you will see, if you know the park, I have been to the park so many times. There are designs for if in the event that we lose some other senior politicians and statesmen, they could also be buried there. Now, the man left office in January 2017, and another man assumes power. The castle grounds is a security enclave. So the duty of the entity that is supposed to take very good care of the grounds, including design and manicure and keeping it in a good ambience, lies with the castle management team. And the castle is an annex of the office of the president. So how do you expect President Mahama to still be in charge of maintenance of ASOMDWEE Park? That reasoning, it's so illogical. So that fallacy must be exposed. 2, it is also not correct that in establishing the foundation in memory of President Mills, we ignore what Kokwanyido created. Can I get up today and establish a foundation in memory of President Rawlings without any recourse to the family? Can I, as a private citizen, do that? Can I today set up any foundation in memory of President Nkrumah without any recourse to the family of President Nkrumah?
Right.
It's not possible. So so I think that what Kwaku is doing is rather a busybody. If you get up and set up a foundation under a president under whom you worked without recourse to the family, you are being a busybody. There are laws and cultural values in this country. You can't do that. 3rd, how come that we decide to remodel whatever it is, the ASOMDWEE Park, to the extent that it is affecting the nature and character of the grave and tombstone of
what proof do you have in
I have photographs.
respect? Because as far as the tombstone, he is saying that it was just a piece of wood, his words, covering the place. And in other words, it wasn't dignifying of our former head of state, and that now they're going to use granite and other things to give him something befitting. And that, yesterday when Samuel Atta Mills suggested that maybe the body of the late president had been, so to speak, exhumed or moved, he asked him where the evidence was, and that nothing of that nature had happened.
You see, you can deny matters when queries are raised. But the question is, why do you undertake anything that affects the nature and character of the tomb without recourse to the family and the children?
That has been raised.
Yes.
Proper procedure.
Yes, but,
I was speaking this morning to Dr. Kwame Asaka.
Yes, I heard you. I heard you. And I'm saying, if anybody says that the existing grave is not made of marble stone, it's a big lie. Because when President Mills was buried, I was around. When other annual events were undertaken by the party and other family members, and we visited the park, I went. So I saw how the grave was designed prior to now. In fact, and
how the grave was designed, was it befitting of our?
It was befitting. How else do you want a grave of a former president to be designed? The man lived a very modest life, even when he was occupying the high office of the president.
So when it was overgrown with weeds and all of that, was the duty
of
a former president?
No, it was the duty of the current president to maintain the gardens. I have made that point. No person can get up and go and clear ASOMDWEE gardens without recourse to the castle security. How does anybody expect that you can get up and go to ASOMDWEE with a cutlass to go and clear without having clearance from the national security or security apparatus of the office of the president?
So when Kwaku blames the former president, is he just embarking on a wild goose chase?
Kwaku has no basis. The kind of comments, like he's my brother, but the kind of comments he's making and continue to make about this matter, it's so fallacious. Now, I also doubt very much that Coastal Development Authority.
Right, and I was about to get there,
yes,
because of the authorization.
Yes.
The Coastal Development Authority is in the thick of things, and Koko Anyidoho has been commending the current president, for example, for his role in all of that. But now that this has come to the fore, people are also condemning the presidency because guess what? If anything was done, it was done on the blind side of the family. And they're accusing both Koda and the presidency.
And let me make this point.
Is that correct?
Hold on.
Is that justified?
I want to make this point. I would dare anybody to go and take the contract that Koda would have awarded to any organization to improve the ambience of ASOMDWEE Park, including the grave. I don't think Koda would have done that. Koda would have been interested in improving the ambience, in improving the infrastructure, maybe building other structures that when people visit, they could utilize, but not to touch the nature and character of the tombstone. Koda will never do that. So we have a problem. And the photographs I saw that Neil and Vanappo and Co went to take yesterday, you can't, that amounts
so paint
to
a
like,
picture for us from the pictures you've seen. Paint a picture for us, and maybe you can share with us.
Look, they are adding, like he said, they are practically adding some mortar and other things to the shape of the grave, and in an attempt to improve its shape and look. I don't know what that means.
What do you think the motive could be? Embarking on this exercise because we are now coming to know about this. So the media wasn't in the know, ordinary Ghanaians weren't in the know, and maybe we can be sidelined. But how about the family not being in the know? How do you feel about that?
There's been a banter between the family and Koko Anyidoho for the past 10 years about this matter. If you follow this issue critically,
right?
Every year when it's about the anniversary time, there's some banter, and this autopsy, reproduction of autopsy report. This is not the first time. Well. No, you've already asked.
He's constantly been saying that use the autopsy report. Why can't we do that?
But the autopsy report is a medical report.
But so, especially as these aspersions are being cast by...
there are times when he's gone,
I can go to his page on Twitter and read for you. I see a lot of messages come up, and he's often talking about, and I dare the former President Mahama, and I dare the former President Mahama.
You see,
why don't you just get this albatross off of your neck?
The death of the former president is a matter of confidentiality for the state. The President Mahama is no longer in office.
Confidentiality, even if
allegedly,
when people allege foul play, people are alleging foul play.
See, you journalists, when people allege some of these things, interrogate the matter. This is a medical record.
That is why
we are doing.
He who alleges must prove.
Yes.
We do that. But you on the other end, you are in pole position now to disabuse the minds of people when it comes to what the reality is.
Which I'm doing. So I'm stating the fact that the death certificate or the reasons why former President Mills died, it's a matter of medical confidentiality. But it's also a matter of state secrecy. So if the president is willing to release those records, he has the power to do so. The former president died in office. So nothing about his death is hidden from the office of the president. And not just the office of the president, but an occupant of the office of the president. President Mahama is not in office. So if Koko Anyidoho is making an allegation, he should direct the allegation to the office of the president. That he has these other issues. So he is daring the office of the president to release those records and let us all interrogate it. In any case, the family has been saying that they've gone through so much trauma. It's 10 years. They want to move on. And you keep digging. Every time Koko Anyidoho will dig about the posthumous, the pathology report of the president.
Is that a problem for the NDC?
It's not a problem. The NDC hasn't, I don't think the NDC has waded into this matter, but the banter has actually been between Kweku and the close family members of the president.
Was it necessary for you to create another Atta Mills Institute when Kweku had already created one?
Why is Kweku the NDC? Kweku is not the NDC. So if the NDC as an entity, NDC as a political organization wants to under the memory of one of his illustrious sons who rose through the ranks to become its president, flag bearer, and president of the Republic of Ghana? Because Kweku Anyido has created some roadside foundation? No.
You call it a roadside?
It's a roadside foundation. What is it doing?
But prior to your creating, I'll be moving on to talk about a health-related matter before I come to you. But he had been doing this for quite a while before you came up with the Atta Mills Institute, your version of it, and you call his a roadside institution.
I take offense to the fact that you keep saying that our version of it.
No, because there are two versions now. There are two different establishments.
What is the capacity, the local standard?
Right now, if there were an event, and he would come with his own portfolio. If you ask the questions, I get you.
Allow me to respond.
He would come with his own portfolio in terms of, this is the Atta Mills Institute, and you would come with yours.
If you ask the question, allow me to respond. What is the local standard of Kweku Anyido in establishing a foundation in memory of Professor Atta Mills?
He served under him.
How many?
You know the capacity in which
I am saying 5,000 other appointees served under Professor Mills as the head of state.
He was a close confidant of the former president.
How close is he? Because he was presidential spokesperson?
Right.
Well, is that it? What about the brother who follows Professor Atta Mills? What should
Samuel Atta Mills, right.
What should he do?
So it appears Kweku is trying more than the Bereaved.
Thank you. Kweku has no locus to even establish a foundation.
Let me quickly ask you this. Do you think Kweku Anyido is being used? Is he being used?
I don't know. And I don't want to venture into that. But I think that he's running himself into problems.
Okay.
You served under the president at his behest. You serve in a certain capacity. The man died in office. And since then, that has ended his political career. So what is this business of trying to own the memory, the heritage of Professor Mills? To what end?
All right. Just hold it there for me. Let me bring in Honorable Nana Yaw Afriyie, Chairman of the Health Committee of Parliament. And we are veering into a slightly different aspect of the conversation. Honorable Dr. Nana Yaw Afriyie, who joins the conversation. He is chairman of the Health Committee. Doc, a very good morning to you. Thank you for joining the conversation. Hello, Doc. If you can hear me.
Yes, I can hear you. Can you hear me?
I can hear you now. I can hear you. Thank you so much for your time.
May I correct this? I've seen this on Joy Online. I've heard this on Joy News. I've corrected you ever. And nowadays, they have introduced Yaw into my name.
Right.
And that started from Joy. And I told you that time, I was not happy. And now everywhere I go, they introduce me as Nana Yaw Eyu. No, I don't have any Yaw in my name. And in fact, I'm Kwame. It is Nana Eyu Afriyie. I am never called Yaw.
Just to get the correction correctly.
Yes, it started with Joy.
Is it
and that day that you did that, and it was also on Joy Online. Ever since 1 year, I've always been called Yaw everywhere I go. I don't want that. I'm never Yaw.
Okay, so
it's not my name.
What is the correct version again?
Nana Eyu Afriyie. Nana Eyu Afriyie. Eyu is an Ekwiapim name. Ewa EW from Mampo Ekwiapim. Okay, I'm from Mampo Ekwiapim and I'm from Ashanti. As my mom is from Ashanti. I beg you, that AU name is from Mampo Ekwiapim. As it is, you should remain AU. I'm never Yaw. Thank you.
All right. Thank you very much. I nearly added you to my own birthday, being a Thursday born. But thank you very much for that correction. Dr. Nana Yaw Afriyie. That's correct, right?
Thank you.
Okay. He is Member of Parliament for Ifiduase Asokore. Thank you so much for joining the conversation. There's been this latest development in respect of a pregnant woman who, needed critical care, did not get that care, and the ambulance service was requesting, a sum of money, some 600 cedis upwards. Parliament has had a look at that entire situation, the Speaker directing on a number of issues. But how did we get here? Because I've heard Professor Zakaria, speak to the matters, and he says, look, we are field for accident-related matters. Anything outside of that usually is an impediment for us, and people would be compelled to do what we did in that instance. Have people cough up money to fill ambulances so they can get critical health care. How did we end up here?
Yeah, thank you very much, and a very good morning to your listeners. I think it's not right because the auditors work on ambulance service, catalog a lot of such irregularities.
Doc, if you could speak up a little for me. I'm struggling a bit to hear you.
The law is not allowing them to charge, okay? And we have realized that various audit reports actually shows charges from various parts of the countries and ongoing. So we made him speak to it, and he also admitted for 16 years that he's been a CEO of the ambulance service, charges have been going on for the past 16 years. So we told him that this is an opportunity for us to correct the wrong, because the objective of their act does not say you should go and charge in issues as this. You understand? And so, if we want to right the wrong, then we must also encourage allocation of resources to the ambulance service, which we can look forward to it at the National Health Insurance Scheme. In this case, we must be able to change the policy to allow for emergency cases or even premium payees or those who are enjoying the scheme to include the services of ambulance care. And this is something that we are going to discuss with the Ministry of Health, that yes, for something to be there 16 years, of which he has admitted that it has been over the past 16 years, he didn't tell a lie on it. My committee is not going to superintend over the emotions over the issues. I am keen about the solutions to the issues. So it is not right. And it is purely not right. We don't have to encourage it. In fact, it has to be condemned. And then we must find solutions through policy.
Go ahead.
As a people, you must pay a little more to enjoy such services in terms of emergency.
Okay, so you're saying as a people we must pay a little more to enjoy such emergency services.
I mean, whatever it is, if we have to pay more in terms of upward adjustment of the premium,
national insurance
premium, pay less, if we have to just add it to the services, whatever it is, for me, as a group who is supposed to meet the ministry next week, Thursday, our interest that we will discuss also in Parliament at plenary will be that we recommend that they should have an inclusion of ambulance services use in the National Health Insurance Scheme. And in this case, I asked them, and they thought it was a good idea. So they would have credit arrangement with all the fuel stations. So what we mean is that, yes, we owe you, but the scheme will pay us. So at any point in time, take care of our cars, so that this issue of fueling would just be, we will just nip it in the bud. We will take it off completely. But now they are not able to make arrangements with the fuel dams or the fuel stations. What they do is that in Takra, they made an arrangement to one Goa station. And that one, it is not even formal. It is those in Western region who have just decided that, look, in times you should help us. And when the people don't help them, there's nothing they can do about it. But if they have proper money coming to them as providers, regardless of the delay, they can have proper arrangements with like Gore or like Shell, any of them. And then at any point in time, their accounts will be fraud. And they can pay for it. And it will be paid for all of us.
It is interesting. You speak about, I mean, I'm thinking about so many things at the same time. We know there are some benefits, some freebies that our pregnant women get when they're going to deliver and all of that, and even prior to delivery, systems that we've put in place. I'm wondering whether it could come under that umbrella, because Augustina Awachi, who was only 31 years, would not have lost her life stuck in Fijai if she had got the right medical assistance. But playing maybe a quick reaction to that.
Yes, it's unfortunate, but just talking about the free maternal health care policy. But if you look at the auditor's report from between 2013 to especially 2021, you see that there have been series of similar deaths. Series. It is as if this one is what has brought our mind to just for us to do a longitudinal research and find. So as we were having our discussions, my members were showing us this year, look at it this year, there were similar things in Rara, like similar conveying patient death.
Definitely. If this has been going on for 16 years, I mean, we're talking now about Augustina. Only God knows how many more people have died.
Sorry?
I'm saying we're speaking now about Augustina, but if this has been going on for 16 years and likely over, only God knows how many people have died on account of this.
Absolutely, absolutely. And that is why the committee is also going to recommend for us to do some sort of maternal mortality audit. So we'll be going to the regions and we'll be looking at those that are related to things about transport. Okay, things like this. And actually, the Ghana Health Service, on that day, they also acknowledge that that is going to be a very good thing for them. So we are interested in the solutions to the issue. So if we have to add it to the free maternal health care policy, so be it. If it's going to be NHI, so be it. The point is that somebody has to pay the money. But our system is saying that it need not be the Ghanaian in terms of the patient or the client. It must be a system or a policy that makes provision for it. So this is for us to have a discussion and decide which area it will be. But we need to find solutions for it. Because it is not only going to Augustina, it is ongoing. We may never know what happened to somebody yesterday.
Right. Right. It could hit very close to home. But maybe to wrap the conversation with you, sir, I'd just like to find out, in the context of the economic situation we find ourselves in, and considering as well that this has taken us all by shock, how immediate is immediate? What is your committee going to push for in the immediate term? And hold on, because I have to make this point. Professor Zachariah makes this point that the NHIA every year allocates 10 million cedis to them.
Right.
There are some 297 stations. Okay. That gives you a sum per station of 33,670 Ghana cedis. Right. Which will be the total amount for each station per year. If you divide this 33,000 by 12, you get 2,806 for each station per month. 2,806 CDs. Look at an ambulance, the size of an ambulance. Look at its consumption. So it means that a lot of the time, they would be very constrained. In the immediate term, what is your committee going to push for?
So that is exactly the reason why I was able to say, I'm sure if your recordings captured it, you saw I made I advised them that yes, the power of my committee in terms of health is not to increase the charges on the consolidated fund, but then also to be able to also reduce it is a prudent measure, and the law allows me to do my work this way. So we told them that, look, going forward, the NHIA formula allocation to ambulance service to take care of fueling, we want you to up it. And if you don't up it, we will find means to frustrate you towards approval of the budget target. And I asked the Ministry of Health, should we strike a deal so that there's a trade-off? And they also agreed that it is emergent, and they are going to make sure that there is going to be provision in that will increase them from the 10 million. And actually, I've called Professor for a meeting. I sent him a text yesterday, and he's waiting to have a meeting with us so that we can commence modalities, okay? And nonetheless, if there's going to be some reserve fund somewhere, okay, some other means to which we can be able to shore their funds up. And not only shoring their funds up, also releasing to them on time.
Right.
Because we're even asking them about the timely releases of it. You was being cautious because definitely the civil servant. Look, but I'm not here to cover anybody. I'm here to do my work for the people. So we also want the timeliness of it, the release. So I will be very happy if you can let us talk about it, like, if not for a week. If not for a week.
Okay. Doc, we're grateful that you took the time to join us on this conversation.
Yeah, if not for a week. If you follow up for like 2 weeks, let's do a serial communication on this issue, okay?
Sure.
So that we can bring meaning to the work we have done. And not just mere talk. I think it's so emotional as a medical doctor. I'm not comfortable with it. My predisposition, I'm not comfortable with it. And I think something can be done. And this is a time we need to get something done for the sake of posterity. Yeah.
All right. Thank you so much for your quick thoughts on this matter. We're very grateful, sir.
All right.
And that has been Dr. Nana Efriye, Member of Parliament for Ifiduase Asokore. He also is chairman of the Health Committee of Parliament. Quick thoughts.
Yes. First of all, listening to the chairman of the Health Committee made me sad.
How so?
Because we have a parliamentary enactment governing the operations of the National Ambulance Service, which is the National Ambulance Act 2020, Act 1041. Now, if you go to Section 15 of the law, it tells you the functions of the service, what they should do, very clearly stated. If you go to Section 13 of the law, it tells you the establishment of a National Ambulance Service Advisory Council with representatives from a lot of health-related agencies. Aside from that, Section 26 speaks of the funds of the service. Money is given by Parliament. They're also supposed to get money from the National Insurance Commission from the sale of stickers, that is roadworthy stickers and insurance stickers. Then they're also supposed to get money from NHIA formula that the chairman alluded to. They're also supposed to get money from donations. And again, they are supposed to get money from the Minister of Finance annually.
Is all of this happening?
Exactly my point.
Because they speak about, Zachariah speaks about NHI giving them 10 million per year. So
yes, and that is NHI alone. What about National Insurance Commission?
And that is it.
What about National Insurance Commission? This year, Parliament approved some amount of money under the budget of the Ministry of Health.
What happened?
Yeah, so when they're interrogating and investigating this particular complaint, I was hoping that they would have recourse to the law to look at what exactly is happening. Under Section 33 of the law, it is an offense for anybody to charge fees.
Right.
From the public.
So we acknowledge that as a fact, but under the constraints.
No, it's an offense.
And else they would have to say, we can't give you.
You see, that is why you have a chief executive. So if there are budgetary constraints, you raise the matter. Because
it doesn't appear Prof has not been raising this.
But the law forbids it. So we shouldn't say that it's happening. The law that sets the ambulance service up, it forbids you charging the public money before you render service.
So Prof and his people are in error, clearly.
They're in error.
Right.
And indeed, the law says that if you are found guilty, you could and if you are convicted somewhere by a court of law, you can suffer between 250 to 1,000 penalty units.
What's the equivalent of that in terms of?
That's 12 Ghana cedis per one penalty unit.
Wow.
So do the calculation. You could also be imprisoned for between 1 year to 3 years. You could also suffer both. So the law setting up the ambulance service is very clear. I was hoping that the committee would make very serious recommendations for the criminal prosecution of these people.
So the 250 penalty units would sum up to 3,000 Ghana cedis.
Exactly, and that's the minimum. And 1,000 penalty units will tell you that's about 12,000.
So that would be 4 times of that, which is 12,000.
Exactly. That's how much, if you are found guilty for taking a pesewa from any person to render ambulance service, and you are found guilty, that's how much you suffer. So the chairman of the committee shouldn't encourage things like it's happening.
Are you disappointed in what the chairman was saying?
Because it appears that they haven't looked at the law. If they look at the law, they will never countenance these things. They would have just recommended straightly.
You're telling me that the chairman of the health committee, who just spoke to me, by the way, and you know, maybe he's not so familiar with what the law says in terms of the provision of funds for
a complaint was made. If I recall, a member of that constituency raised the matter on the floor in a statement. And Speaker, after the debate, referred the matter for further investigations by the health committee. So I was hoping that the health committee will have recourse to the Act of Parliament establishing the ambulance service and see whether the conduct being complained is something that is that the Act countenances. If it is not, it's an outright illegality. That the law says that it should be criminally prosecutable. That's my point. Look, my brother, if we don't ask public servants to comply with the law, we'll run ourselves into these problems. That is why the chief executive is supposed to be reporting annually on their operations. What is the 2021 annual report on the ambulance service? Have they complained about money? The monies they are supposed to get from National Insurance Commission, are they getting it for purposes of their operations? So, I feel sad. I feel sad because when you go to South Dayi, for instance, the ambulance service, every time they must call the MP for some one help or the other.
I was about to ask you, do you often have to step into?
Yes.
You remember the situation where Samuel Okudzeto-Ablakwa had to step in? I think a child and all of that. Eventually, that also led to another.
If there are ties, if there are problems with ties, they call the MP. If they have sometimes fuel, all those things. But you see, the concept of
who calls you?
Oh, it's the officers.
The ambulance service?
Yes, including fire service, they all help, they all call for help. So, but the point I'm making is that the concept of an ambulance service is a concept that is embedded in rendering medical services under emergency situations. Anybody under emergency situation seeking medical attention, you cannot be using an economic bar to prevent him from seeking that medical attention. Otherwise, the person will die. That is why, under our traffic regulations, ambulance is one of the vehicles that is permitted to use a siren and drive through traffic without hindrance.
Do you know what I'm thinking of? Even in light of this Marburg virus that we speak of, which is highly, deadly, contagious as well. I'm just imagining. I mean, sometimes you must think outside of the box. A situation where someone, you have to quarantine and all of that. We will need ambulance service.
Exactly.
How are we going to go about it? Maybe in the meantime, other people get infected because of improper handling of whoever has lightly contracted the virus. If later it turns out to be true, look at the risk involved.
And my worry is, what is the board of the ambulance, the advisory board saying? What has been their role? Because they have clear functions in the law. People just serve in these bodies and take allowances and do nothing.
So what would you like to see? To wrap on this specific end, what would you like to see in the immediate term?
Yes, in the immediate term, I want the health committee to recommend criminal prosecution of this person who engaged in this.
So what? The ambulance service operatives who
because the law says that is what should happen.
Okay.
Don't take money from the public before you render ambulance service. And I also expect the chief executive to resign. You can't come to parliament and say that you've been doing this for 15 years when the law says you cannot.
16 actually.
He himself should resign. Because it means he's breached the law for all these years. Why? Ambulance is to render a service under emergency situation, medical attention. And you're asking for money.
I see this has left you very distraught, and all of us definitely.
Because I was very instrumental when we were crafting this law.
Oh, I see.
Initially, they say it was established under a policy and administrative policy. So we decided to set it up with an act of parliament.
Right.
Give you clear provisions.
So as part of the framers, you feel very...
I feel very slighted that things that we say don't do, you go and do it. So then why did we spend money to buy over 300 ambulances for all the districts in this country? Why?
But there are problems with the purchase of those ambulances.
That is why you are a chief executive.
In fact, that is a situation that is currently pending the Dr. Kasala.
But that is why we have a chief executive. As part of your functions, you must administer the entity purposefully.
Okay. Let's get past that issue. I want us to look at two crucial issues before we look at any add-ons. There's a latest Afrobarometer report, and it makes for some very interesting reading. So it tells us that some 87% of Ghanaians feel the country is not headed in the right direction. About 85% of them feel that when it comes to the economy, the handling of it is also not going in the right direction. And that makes it about 9 out of 10, almost 9 out of 10 who are saying the country is not headed in the right direction. And that is a 24 percentage point increment from just 3 years ago in 2019. You also look at the figures when it says 85% describe the country's economic situation as dire, fairly bad, or very bad, up from 62% recorded in 2019. 72% say their personal living conditions are fairly bad or very bad. And that too is up from 58%. So when you look at the reading, this latest Afrobarometer report, it clearly shows that public sentiment, as far as the report is concerned, are not positive at all. We'll get into some of the details. The sample size, 2,400, and of course, I've forgotten the exact terminology, but plus or minus 2 percentage points in terms of, yes, the margin
of error,
and the sampling done across the country. But what is your reaction to this? As you can see on your screens, that first one there, figure 1, the question is posed, is the country going in the right direction? And you would see the green line reflects those saying the country is headed in the right direction. The red line shows those suggesting the country is headed in the wrong direction. Now look at the trajectory, 2012 to 2022. You would see that in 2012, an electoral year, those who felt the country was going in the right direction were 39% per the survey. Wrong direction, 61% in that same year. In 2014, it was 15%. That was quite a low, but not the lowest we've seen. And then those who felt wrong direction, 85%. In 2017, guess what? It came to 50-50. And this was just after election 2016. But then again, the story started unraveling, because in 2019, it fell in terms of approval ratings, going down to 35%, 59% saying the country was headed in the wrong direction. And in the following the one conducted in 2022, 11% are saying the country is headed in the right direction, while 87% say it is not headed in the right direction. So that is the tail of the tape as far as this chart is concerned. There are more that will be coming your way with. And you can see from here as well a summary of the picture. So looking at it, economic conditions compared to 12 months ago and economic conditions in 12 months' time. When you look at the first chart, 20% feel we're doing better or much better, Roxon. 9% feel we are pretty much at the same levels, and 70% feel we are worse or much worse. In terms of economic conditions, 25% feel we're better or much better. That is in 12 months' time. 18% feel we're practically at the same level. 50% feel come another year, things are going to be worse. What is your quick take on this latest Afrobarometer survey? Reflective, first of all, of the reality?
Yes, thank you very much. I'm sure if some of us have said this, they would have said we're speaking as opposition members, or opposition members of the.
You are an opposition member,
yes,
anyway.
We are, but when you analyze the extremely high, atrocious cost of living standards, you explain the matters, you are branded as an opposition. But I'm very glad that the Afrobarometer report has confirmed the situation. Indeed, some even think that there are pockets of communities or areas in this country where the figures are extremely, in fact, higher than the average being painted. Look, I have a contractor friend. In January this year, he was buying a liter of diesel at, I think, 9 cedis. 9 cedis. Now it is nearly 14 cedis. So he tells me
at least there have been some slight decrements in recent times, but it's still high.
It's teetering around 14, 13.9, 13.7, depending on the station you are buying. So he tells me that for every liter of diesel that he used to purchase in January, just this year, 6 months ago, now he needs about 6 cedis more to be able to buy that. Or
per liter?
Per liter.
Right.
Or 5 cedis more to be able to buy that.
Because yes, 9 to about 14.
Yes.
So that's the difference.
So the cost of fuel alone has added to their cost build-up for the kind of constructional works they do by about 30 to 40%. Unanticipated. And you know, for any economy, it is transportation that drives the economy. The people must move. It's mobility of goods and services that drives the economy. So if the people are not mobile in the economy will stagnate. Okay? So the cost of fuel alone has affected cost of living so much that persons who transport foodstuff from the hinterland to the peri-urban and urban areas now have had to practically double their prices. You get to Germany, for instance, the cost of premix, okay, and I'll use the Kufuor gallon. They used to buy Kufuor gallon 80 cedis just about December last year. Now it is 240 to 300 cedis. You may not even get it. And why am I speaking about premix? Because this is the fuel that the Arbor motor owners use to bring foodstuff from the front plains to Germany so that my people in South Dayi can get. They bring it to Kweve so my people in South Dayi can get. The fishermen.
Because they also have fishing communities.
Exactly, the fishermen. And because of its scarcity, they are not even able to go fish as frequently as before. And this will lead to shortages. And when shortages occur, prices will go up. These are very simple, basic economic matrices that is playing out. So when people complain that the economy is not in the right direction, they are right. But I'm shocked about the percentages.
Just look at your screen.
Yes,
I mean,
I'm shocked. Yes,
those who feel evaluation of government's economic performance, you would see that all the yellows are performance. Those who think it is fairly well or very well, and all the red or close to red shade are those who feel government is performing fairly badly or very badly. Now look at the different dynamics. Managing the economy, 82%, faring badly. Creating jobs, 83%, improving the living standards of the poor. And now we have LEAP people who have not been paid for 6 months, 85%, narrowing the income gap, 92%, keeping prices stable. All these people, 94%, feel government is performing fairly badly or very badly in all these aspects.
In statistics, we call all these figures in the upper quartile. All the percentages we are seeing are all in the upper quartile. Very, very high. Look, government expenditure is still very high. Government is still living large. We are hoping that government will cut down on its size. Government has 2, 3, 4 deputy chief executives in places. Look, if you read the recent State Enterprises Agency report on state enterprises, nearly 90% of the enterprises are making losses, very heavy losses. But check their reports to Parliament, their annual performance reports.
Right.
They've all increased.
Yeah.
You know, the expenditures are towards human resources and all that. If you interrogate the matter, they are employing more. I am not saying they shouldn't employ. But the level of employment must be commensurate with performance, output.
You can even look at the perks they are giving.
Yes,
but you are making losses. There, top officers,
yes,
there, especially when you're incurring losses.
Yes, you are incurring heavy losses, and you are recruiting. So the personnel are not contributing towards the. And this is basic economics. Okay. Recently, we've increased licensing fees. Public services that people patronize. We've increased the fees by between 20 to 25 to 30% on the average. So if you want a death certificate or a birth certificate for a child born or for a case of a mortality reported, you'll be paying 30% more for a death certificate or a birth certificate. All right? PURC intends to increase the prices of utilities. They just came to Parliament. So things are extremely difficult for people. I heard you this morning where persons have parked their vehicles and they are taking Uber.
I know people who tell me, look, it's no longer cost efficient for me, looking at the nature of the vehicle I have, to use maybe my 4x4, my V6 or V8 or whatever. So it's more cost efficient for me to board the trotro. And that could be that is the reality of some people.
I agree with you. And look, in sometime March, April, if you see traffic in town, sometimes you feel like getting down and walking to wherever you are going. But check the traffic situation in town. Traffic is flowing. It meant that a lot more persons have parked their vehicles. And it struck me this morning when I was early in the morning around 6 a.m., 5:30, when you do that very early morning analysis and interview people on the news. And I saw that this is happening. And when your reporter went to Tema to speak about the patronage of the train service, you saw the reaction of people.
So for you, I just wanted to wrap with two quick points. But for you, this is very reflective of
It's very reflective.
It's very reflective.
Very, very reflective. It's even the average.
So maybe a good thing to ponder that government is going for this $1 billion syndicated loan. Maybe you should be supporting them so that it can ease some of the pressure. Very quickly, maybe some.
We are supporting government. But let me say this. As part of the purposes, government recently took 75 million euros. Do you know what they said they will use it for? To buy PPE materials. They are not saying they are building a hospital to generate revenue. On consumables, government is taking $750 million. Go and see the kind of things they want to apply it to.
What PPE are we buying again?
Thank you. What PPE are we buying again?
No, I'm asking you. You're a member of parliament.
Yes, we are asking them.
What PPE are we buying?
Including holding training sessions.
Holding training sessions?
Training sessions.
For what exactly?
Thank you. For what exactly? Improving the standards of frontline health staff. All those things. 75 million euros. I'll send you the purpose for which they've taken that loan. So when government is procuring more loan facilities just to apply them to unnecessaries, it's a bother. They want to apply as part of the 750 million.
Final point on that.
Yes, they want to apply as much as in excess of 100 million to host some African games. Hosting African games. Flower pot project that has been completed. Government indicates as part of this facility that they want to apply some of this facility. They have to come and clarify that project. We gave some money to Ministry of Youth and Sports, I think towards building some stadia. Parliament approved it. They said they couldn't draw down that loan from Car Bank. So they've come back to Parliament to say that as part of this 750, they'll use part of that money. But if we approve a facility for you and you couldn't draw down on it, you need to come back to Parliament to report. You don't take another facility and divert part of it to apply for that project. So this is the worry of the minority in respect of this $750 million.
As we've heard, as of yesterday, it appears there's some positive push. So is it inching towards?
No, we asked for the purpose.
Right.
And when they produce the purpose for which they are taking this facility, these are the details.
So still, the position of the minority is that you're not going to...
We will support government in these austere times. But government must be prudent. Government must be truthful to the people.
Okay, point made. Let's wrap the conversation on these two. I want you to focus more on the fact that Communications Minister Ursula Owusu-Ekufo has failed to show up in Parliament. She has been in Parliament to answer questions, but within the last period that we're looking at under review, she's not been able to attend to, when she's been called upon by the House, so to speak. I want you to address that, what the real issue is, why the minority feels aggrieved, and then I'll throw in, at the end, I want you to also add this bit, your thinking on this latest Global Info Analytics survey that positions former President Mahama, puts him in pole position in terms of whoever leads the MPP, especially the top two suggested or purported top two candidates, Bawumia, the vice president, Mahama is leading him by 58% to 31%. And then Alan Chamanting, it is 61% to 30%. I want you to talk about Esle Usu-Ekufo, and then in wrapping, just give me your thoughts on how reflective this latest survey by Global Info Analytics is. And then we'll wrap this conversation.
Thank you.
We don't have much time.
Yes, so Parliament, as part of exercising its oversight, uses question time to request ministers to come and account or brief Parliament on some projects or policy being implemented by the agency. And as part of our standing orders, if a question is filed and admitted, it must not take a minister more than 3 weeks. So we call it the 3 weeks rule to come and answer. The evidence will bear us out that even a minister of state at the office of the president, the office of the president, you can't bring the chief of staff to Parliament. So if there's a minister of state serving at the office of the presidency, you direct questions at him or her. The whole of the life of this 8th Parliament, the minister at the office of the president has refused to come to Parliament to answer questions. Questions that have been directed to him. He keeps writing to Parliament that he wants to defer, he wants more time to come and answer. That's one instance. The matter in question that my chief whip raised is that the questions in reference, the ministry of the minister has always been writing to Parliament to defer. That was what egged his displeasure. That was what attracted the displeasure of the chief whip. That why is it that sometimes you come and sit in Parliament? Yes, you come and sit in Parliament, but your directors or senior public servants will be writing to Parliament asking for more time to enable you to come and answer these questions, when sometimes you come and sit and participate in debates. So that's why he said that he's happy that she herself was in the House, but the constant writing of letters to ask for more time by her senior public servants is causing disrespect.
What do you think the cause is? Because she must also be properly prepared before she comes before the House to answer any questions.
So why don't you come and say so?
But that is exactly what
there are a lot of questions. So all the 5 questions you need time. 5 questions touching on different sectors.
I mean, to be fair, if she comes to Parliament, you bombard her from on all aspects of.
She also bombards people when she was in opposition. When ministers were asking,
so more reason for her to be prepared. It is not
about bombardment. It's about the fact that they are finding a very convenient means to avoid answering the questions.
You think she's avoiding accountability?
Of course, because it is not all the questions that you need time to come and answer. And these are not questions that were filed yesterday. Some of these questions are as old as 1 year. That is what is attracting the displeasure of the members.
Very quickly, just for the sake of our...
But I want to comment...
What are some of the
I want to comment 2 or 3 ministers. The Rules Minister, the Minister of Fisheries, the Honorable Peter Amewu, and a few others who constantly will come to attend to the House and answer questions. You see, where commendation is due, let's give it. So I want to commend these ministers who, whenever the questions are asked... In fact, Amewu came last week. We were doing consideration. We took his questions nearly at 5 p.m. He sat in the House patiently, participated in the business. Normally, questions times are in the morning. But the House told him that he has to abide.
Okay.
And he did. So when people are committed to accounting to Parliament, let's commend them. And when you come and sit in Parliament, but you won't come and answer your questions, we have to condemn you.
All right. The final bit about the survey.
Yes.
You have survey, 1 minute.
Yes, it's good. As an NDC, we'll take it in good faith. We'll work on it.
I'm sure you're taking it because it's positive it's in your favor.
Nobody parries positives away from himself or herself. You must always welcome positive things and keep working to improve and attract more positives. And that's what we are doing. And we are winning 2024.
The MPP wants to break the 8. And you're here saying...
Even internally, they can't break the 8. How many of them broke the 8 internally last Saturday? That's an indication. Internally...
You mean the changes?
Internally, they can't even break 8. As for breaking the 8, it's a wishful thinking.
Wishful thinking.
It's wishful thinking. They are going home.
Thank you, Rockson-Nelson Dafeamekpor, Member of Parliament for South Dayi, for joining the conversation.
It's my pleasure.
But coming up, a whole lot, we'll be heading to Swami for your Citizens Microphone as we talk about the situation there, where artisans are asking government to fix the deplorable roads in that enclave. We will also be talking to you about the EcoBank Joy News Habitat Fair and what you can expect ahead of the first clinic, which comes off this.
Can I make a small public announcement?
Right, go.
Yes, the EPSU, that's the EP Student Union of the Evangelical Presbyterian Church, they are holding their National Annual Congress at Peki Blango. That's the EP seminary on the 5th of August, Friday. We are inviting everyone to come and participate.
So you're a member of the EP Church?
Yes, I'm a member. And I used to be an EPSU member, University of Cape Coast.
I see.
Yes.
All right. So more on those issues I spoke about coming up next on the AM show with Bernice Abubeidu Lanza. Stay.